If you have diabetes, change your diet, take medication, and still your glucose levels don't stabilize, this video is for you. Often, the problem isn't what's in excess in your diet, but what's lacking in your body. Some nutritional deficiencies can make controlling blood sugar very difficult without you even realizing it. Today, I'm going to show you 8 nutrients that make all the difference. Let's get to today's video.
Magnesium is one of the most important minerals for people with diabetes, and at the same time one of the most neglected. It directly participates in the functioning of insulin within the body. In simple terms, magnesium helps insulin open the door of cells so that glucose can enter and be used as energy. When magnesium levels are low, this door begins to jam. Glucose circulates in the blood, and the body needs to produce more and more insulin to try to compensate. Over time, this constant effort favors insulin resistance, one of the main mechanisms behind type 2 diabetes and the difficulty in controlling blood glucose. Even people who follow a diet, use medication, and avoid sugar may continue to have unstable glucose levels precisely because magnesium is lacking. It's like trying to drive a car with little oil in the engine. It will still run, but with much more wear and tear. The signs of magnesium deficiency are not always obvious, but they are extremely common. Frequent fatigue, feelings of weakness, difficulty concentrating, muscle cramps, tingling, and even palpitations may be linked to low levels of this mineral. In the day-to-day life of diabetes, this translates into glucose spikes and drops, difficulty in maintaining stable numbers, and that feeling that the body never responds as expected. Another important point is that high glucose levels increase magnesium loss through urine. In other words, diabetes can cause magnesium deficiency, and a lack of magnesium can worsen diabetes. This creates a silent cycle that overloads the metabolism over time. The more deregulated the glucose, the greater the chance that the body will eliminate this essential nutrient, making glycemic control even more difficult. In addition, magnesium plays a fundamental role in muscle health, nerve function, and inflammation control. When it is low, the body enters a state of greater metabolic stress, which directly interferes with insulin sensitivity. It is no coincidence that studies associate adequate magnesium levels with better glucose control and a lower risk of diabetes complications. Understanding the importance of magnesium changes the way you view diabetes management. It's not just about avoiding sugar or reducing carbohydrates, but about ensuring the body has the right nutrients to function properly. When magnesium levels are adequate, insulin works better, glucose enters cells more easily, and the metabolism is less overloaded. This is a fundamental step for those seeking more stability, more energy, and more efficient diabetes management in their daily lives. Vitamin D is often associated only with bone health, but its role in diabetes goes far beyond that. In practice, vitamin D acts as an important regulator of the immune system, inflammation, and how the body responds to insulin. When levels are adequate, cells tend to respond better to insulin, facilitating glucose uptake and helping to balance blood sugar. The problem is that vitamin D deficiency is extremely common, especially in people with diabetes or prediabetes. Even living in sunny regions, many people spend most of the day indoors, frequently use sunscreen, or have difficulty absorbing this nutrient. The result is a low level of vitamin D that goes unnoticed, but directly impacts glucose metabolism. When vitamin D is low, the body enters a state of low-grade chronic inflammation. This silent inflammation interferes with insulin action, promoting insulin resistance and making glycemic control difficult. In practice, this means that glucose tends to become more unstable, with spikes after meals and greater difficulty in keeping the numbers within the desired range, even with diet and medication. In addition, vitamin D participates in the functioning of the beta cells of the pancreas, responsible for insulin production. Inadequate levels can compromise this function over time, increasing the effort of the pancreas and worsening the metabolic imbalance. Therefore, many people feel that glucose doesn't respond as it should, without imagining that the root of the problem may be linked to this deficiency. The signs of vitamin D deficiency are not always clear. Persistent fatigue, muscle pain, low immunity, mood swings, and greater difficulty in physical recovery may be related. In people with diabetes, these signs often mix with the symptoms of the disease itself, which makes the deficiency even more difficult to identify without tests. Understanding the importance of vitamin D in diabetes management helps to broaden the view of metabolic health. It's not just about diet or cutting out sugar, but about ensuring that the body has the necessary conditions to respond well to insulin. When vitamin D levels are adequate, glucose metabolism functions more efficiently, inflammation decreases, and glycemic control tends to become more stable on a daily basis. Vitamin B12 plays a fundamental role in the functioning of the nervous system and in the body's energy production. And this is especially important for those living with diabetes. It is essential for nerve health, helping to maintain proper communication between the brain and the rest of the body. When B12 levels are low, the nerves begin to suffer, which can generate symptoms that many people with diabetes are already familiar with, such as tingling, numbness in the hands and feet, burning sensation, and loss of sensation. In addition, vitamin B12 is directly involved in energy metabolism. It helps the body transform food into usable energy. When there is a deficiency, persistent fatigue, muscle weakness, difficulty concentrating, and that constant feeling of tiredness, even after sleeping well, are common. In people with diabetes, these symptoms are often confused with the effects of unregulated glucose itself, which causes the deficiency to go unnoticed for a long time. An extremely important point, and one that deserves special attention, is the use of metformin. This medication, widely prescribed for the control of type 2 diabetes, can reduce the absorption of vitamin B12 over time. In other words, those who use metformin for months or years have a higher risk of developing a B12 deficiency without realizing it. This is a detail that is not always discussed in consultations, but it makes all the difference in the patient's quality of life and neurological health. When B12 deficiency is combined with diabetes, the risk of nerve problems increases. Symptoms of neuropathy may intensify. Fatigue becomes more frequent, and the body begins to respond worse to daily stimuli. This directly impacts disposition, well-being, and even adherence to treatment, because the person feels constantly exhausted. Taking care of vitamin B12 levels is a way to protect the nerves, improve energy, and prevent symptoms from being attributed solely to diabetes, when, in fact, they may have another correctable cause. Monitoring this nutrient, especially in those who use metformin, is an act of prevention and self-care. When B12 levels are balanced, the nervous system functions better. The body produces energy more efficiently, and daily life with diabetes becomes easier and more manageable. Vitamin D is often associated only with bone health, but its role in diabetes goes far beyond that. In practice, vitamin D acts as an important regulator of the immune system, inflammation, and how the body responds to insulin. When levels are adequate, cells tend to respond better to insulin, facilitating glucose uptake and helping to balance blood sugar. The problem is that vitamin D deficiency is extremely common, especially in people with diabetes or prediabetes. Even living in sunny regions, many people spend most of the day indoors, frequently use sunscreen, or have difficulty absorbing this nutrient. The result is a low level of vitamin D that goes unnoticed, but directly impacts glucose metabolism. When vitamin D is low, the body enters a state of low-grade chronic inflammation. This silent inflammation interferes with insulin action, promoting insulin resistance and making glycemic control difficult. In practice, this means that glucose tends to become more unstable, with spikes after meals and greater difficulty in keeping the numbers within the desired range, even with diet and medication. In addition, vitamin D participates in the functioning of the beta cells of the pancreas, responsible for insulin production. Inadequate levels can compromise this function over time, increasing the effort of the pancreas and worsening the metabolic imbalance. Therefore, many people feel that glucose doesn't respond as it should, without imagining that the root of the problem may be linked to this deficiency. The signs of vitamin D deficiency are not always clear. Persistent fatigue, muscle pain, low immunity, mood swings, and greater difficulty in physical recovery may be related. In people with diabetes, these signs often mix with the symptoms of the disease itself, which makes the deficiency even more difficult to identify without tests. Understanding the importance of vitamin D in diabetes management helps to broaden the view of metabolic health. It's not just about diet or cutting out sugar, but about ensuring that the body has the necessary conditions to respond well to insulin. When vitamin D levels are adequate, glucose metabolism functions more efficiently, inflammation decreases, and glycemic control tends to become more stable on a daily basis. Chromium is a mineral that works behind the scenes in metabolism, but it has a direct impact on how insulin functions in the body. Simply put, chromium helps insulin do its job better by increasing the sensitivity of cells to this hormone. When there is enough chromium, glucose can enter cells more easily and be used as energy. When there is a lack of it, insulin is present, but it cannot act efficiently. Chromium deficiency can significantly worsen insulin resistance, one of the main challenges in type 2 diabetes and prediabetes. In this scenario, the body needs to produce more and more insulin to try to control glucose, but the effect is limited. This results in frequent blood sugar spikes and greater difficulty in maintaining stable blood glucose levels throughout the day, even with controlled diet and medication. In practice, people with low chromium levels often notice greater glucose fluctuations, especially after meals. It is common to feel that small dietary slips cause large increases in blood sugar, which generates frustration and a feeling of lack of control. This effect doesn't happen by chance, but because insulin isn't being used properly by the body. Another important point is that high glucose levels also increase chromium loss through urine, creating a cycle similar to what happens with other minerals. The more unregulated the glucose, the greater the elimination of chromium. and the less chromium available, the greater the insulin resistance. This silent cycle makes controlling diabetes increasingly difficult over time. The signs of chromium deficiency are not very specific, which causes the problem to go unnoticed. Fatigue, cravings for sweets, difficulty concentrating, and frequent glucose fluctuations may be related. In people with diabetes, these signs are often attributed only to diet or stress, without considering the possibility of nutritional deficiency. Understanding the role of chromium helps broaden the perspective on diabetes management. It's not just about cutting out sugar, but about ensuring that insulin can work as efficiently as possible. When chromium levels are adequate, the insulin response improves, glucose fluctuations decrease, and glycemic control tends to become more predictable and stable throughout the day. Potassium is an essential mineral for the body's functioning, especially for muscles, nerves, and fluid balance. It helps regulate muscle contractions, heart rhythm, and communication between cells. In the context of diabetes, potassium also plays an important role in the metabolic response and how the body reacts to insulin. Even if this is not always frequently discussed, when potassium levels are low, the body begins to show signs that many people interpret simply as everyday fatigue. Muscle weakness, a feeling of heaviness in the legs, lack of energy, difficulty moving, and even cramps can appear. In people with diabetes, these symptoms end up being normalized, as if they were an inevitable part of the routine, when in fact they may be linked to a nutritional deficiency. The relationship between potassium and insulin sensitivity occurs because this mineral participates in the transport of glucose into cells and the electrical balance necessary for metabolic reactions to occur correctly. Low potassium levels can disrupt this dynamic, causing glucose to remain in the blood longer and making it more difficult to maintain stable blood glucose levels throughout the day. In addition, changes in potassium levels can interfere with how the body handles carbohydrates after meals. This can result in more intense glucose spikes and slower recovery, creating the feeling that the metabolism is stuck. Over time, this instability contributes to constant fatigue and a less efficient response to insulin. Another important point is that some medications used to treat diabetes and high blood pressure can influence potassium levels. This reinforces the importance of monitoring this mineral, as both deficiency and excess can cause symptoms and disrupt the body's balance. Understanding the role of potassium helps differentiate between occasional tiredness and what may be a sign of internal imbalance. When levels are adequate, muscles function better, energy improves, and the metabolic response becomes more efficient. For those with diabetes, this means more energy in daily life and more stable and predictable glucose control. Omega-3 is often known simply as a good fat, but its role in diabetes goes far beyond that. This type of fat plays an important role in controlling inflammation and insulin sensitivity, two key factors for those seeking to maintain more stable glucose levels. When omega-3 is present at adequate levels, the body tends to respond better to insulin, facilitating the use of glucose by cells. Omega-3 deficiency favors a state of low-grade chronic inflammation, something very common in people with diabetes. This silent inflammation directly interferes with insulin action, increasing insulin resistance and making glycemic control more difficult. In practice, this translates into more frequent glucose spikes, greater difficulty after meals, and a feeling that the body is always fighting to maintain balance. Another important point is that omega-3 has a direct impact on cardiovascular health. One of the biggest concerns in diabetes, it helps improve blood lipid profiles, reduces inflammatory processes in blood vessels, and contributes to healthier circulation. When there is a deficiency, cardiovascular risk tends to increase, making diabetes control even more challenging in the long term. In addition, omega-3 participates in communication between cells and the flexibility of cell membranes. This influences how insulin binds to cells and how metabolic signals are transmitted. Without adequate amounts of this fat, cells become less responsive, which impairs glucose utilization and increases glycemic instability. Signs of omega-3 deficiency can be subtle, such as dry skin, joint pain, mood swings, and fatigue. But the metabolic impact occurs even before these symptoms become evident. Many people with diabetes do not realize that a diet poor in omega-3 sources may be hindering glucose control. Understanding the role of omega-3 helps broaden the perspective on diabetes care. It's not just about avoiding bad foods, but about providing the body with fats that protect, reduce inflammation, and improve insulin response. When omega-3 levels are balanced, glycemic control tends to improve, and cardiovascular health receives essential long-term support. After exploring these 8 deficiencies, it becomes clear that controlling diabetes isn't just about cutting out sugar or following strict dietary rules. The secret lies in nourishing the body correctly, ensuring that each system functions in balance. Often, small adjustments to the diet including magnesium, vitamin D, B12, zinc, chromium, potassium, iron, and omega-3 can make a huge difference in how glucose responds throughout the day. When the body receives the nutrients it needs, insulin can work better, insulin resistance decreases, blood sugar spikes and drops become more controlled, and energy improves. It's not about radically transforming your routine overnight, but about creating consistency, noticing the body's signals, and acting intelligently to support metabolism. The impact of these deficiencies isn't just physical. They can lead to fatigue, weakness, tingling, a constant feeling of hunger, difficulty maintaining stable glucose levels, and even affect immunity. By understanding what's missing in your body, you gain clarity on why, sometimes, even with a balanced diet and medication, results still don't appear. This gives you back power. You stop feeling at the mercy of the disease, and start making decisions that truly help your pancreas and the entire metabolic system. If any of these shortcomings resonated with you, or if you've ever had abnormal test results and didn't quite understand why, leave a comment below. You can write something like this message was for me, or I'm with you. Until the end, your participation not only shows that you're following the content, but also helps our team understand which topics are most important to you, so we can further explore themes that make a difference in your health and glucose control. If this content helped you better understand your body and how your pancreas works, naturally give it a like. Each like shows that it's worthwhile to create more educational and detailed videos like this one, and strengthens the community of people who, like you, want to learn how to manage their diabetes with clear and practical information. Education is a powerful tool for reducing the body's burden and sharing your experience in the comments also helps others feel understood and motivated to take action. To continue learning about nutrition, habits, and glucose control in a clear, practical, and realistic way, subscribe to the channel. Here, each video is designed to help you understand what truly impacts your metabolic health, without miraculous promises, but with strategies based on science and clinical experience. In addition, there are other videos related to diabetes on this channel that complement this topic, offering more insights on how to support the pancreas, improve insulin sensitivity, and optimize glucose control in daily life. It's not necessary to watch them all at once, but following the channel allows you to build knowledge continuously, step by step, strengthening habits that truly make a difference in your life. Remember, diabetes management is not about perfection, but about consistency and smart choices. Every balanced meal, every adequate micronutrient, every healthy lifestyle habit is an investment in your well-being, energy, and longevity. If you've made it this far, it shows you're interested in deeply understanding how the body works and how small actions can generate big results. So comment, like, subscribe, and keep following along. We're in this journey of learning and healthcare together.